So lymphoma is not a good disease, very bad disease, and it's very. If you are getting the diagnosis of malignant lymphoma, you should be very afraid. But still, as I mentioned you before, around half of the patient with advanced stage can be cured with chemotherapy. So, in some meaning, it can be a lucky. If you have the stage 4 lung cancers or gastric cancers or hepatocellular carcinomas, you have no chance, just prolong or survive a little longer. But I have many patients just return back to normal life, and even some of my patients married and have a child and getting the promotion in the companies, so that can happen. Never be afraid to getting lymphoma. You can be cured.
Not only the most curable lymphoma, you can argue it's probably the most curable cancer in all human beings. Some people argue, depends on who you ask, that maybe testicular cancer is just as curable and maybe even more curable than Hodgkin's, but that if you're a man. So if you're a woman, as Hodgkin's is the most curable cancer.
So the most important message for young Hodgkin lymphoma patient is to return back your life as soon as possible. Your life is much longer after the cure of the disease.
Well, lymphomas are very different from other solid tumors because in lymphomas, if you're looking at people with advanced stage illness, they still have a very high chance of being cured. Whereas if you look at other solid tumors, when patients are in an advanced stage with dissemination to other organs, then the cure rate is actually very small. Now, in lymphomas, particularly B-cell lymphomas, many patients present with advanced stage illness, in stage 3 and 4 illness. But we're still looking at a cure rate of somewhere around 40 to 50% for these patients. So one should really be very optimistic as far as these patients are concerned.
It's very important to be able or willing to receive support from the family and friends. Many of my patients, they're very strong and high functional, but when they get sick, I always tell them this is the time to receive help. This is the time that you should be able to say, okay, you can help me because that's when I need it.
So we do encourage our patient relatives to bring in their own food so that patients can maintain a good nutritional status. And I think family support is also very important in giving the patient a positive outlook. In many patients, in fact, lymphomas can be permanently cured. It is an important message that we have to put to our patient as well as to their relatives.
So September 15th is World Lymphoma Day, and we celebrate that to try to improve our treatment for patients with lymphoma. Lymphoma is, in many cases, a curable type of cancer as compared to some others, and so even though we may say that to patients sometimes, that we say this is a good cancer to get, there's no cancer that's a good cancer to get, unfortunately. As we try to improve our treatments for all types of patients with cancer, we continue to improve our treatment with lymphoma patients as well, and hopefully we'll continue to increase the cure rate in all patients with lymphoma. 9/15 World Lymphoma Day.
World Lymphoma Day.
It's a curable cancer.